All right, so how's it going, everybody? Today we'll talk about goniometry again, but specifically with the shoulder joint and actually a little bit of the upper extremity. We'll do shoulder and maybe forearm stuff. But one of the things I would tell you to consider is that there's a difference when you're doing the goniometry stuff and you're doing it for a test, for testing purposes, and if you're going to do it for the clinic, because then you're going to be more practical about the whole thing. So I'll try to talk a little bit about both of the scenarios. If you're a student, you're looking to pass academic coursework, or you're on your level 2 rotations and you're looking to pass your clinical rotations, or you're testing for the MBCOT, you want to be very specific with the information that you're getting from the textbook, the theoretical information. So based on the question that you're getting from your CI or from the test question, you want to pay specific attention to like the diagnoses that you're dealing with, any other diagnosis that the client may have, and that'll help you determine the position that you're going to place them in. Also, keep in mind that if you're doing like a lab or something, you want to know what the instructor's expectation is for the positioning. As you look through your textbook through how you position the client, some of the textbooks will have like a primary position, secondary, or alternate position. So you want to be able to know which one you're going to use depending on the specific scenario. In testing environment, for testing purposes, stick to the textbook. In a real world scenario, you're going to be able to try to get the person into a position as close as possible to that, but keep it in mind that you might have to, change the position to something that's more easy for the client to be in, and also for you to be able to get access to that particular joint. The great thing about goniometry that I like is that no matter what the position, if you put your access point in the right spot and you know how to measure degrees and you know what the expected range of motion is, you really can't mess it up, because numbers are numbers, math is math. Degrees of movement, as long as you have your true access point and you're having a good starting position, your stationary arm is where it needs to be, the degrees of motion are going to be fine. To improve inter-rater results and to get the most accurate results, you want to make sure you stick to the textbook and try to get that position in the optimal situation. The other thing too is that in the textbook environment, classroom environment, testing environment, the terminology is key. You need to know what the movable arm, where it is, where it's staying. You need to know where the stationary arm, where it's positioned, and what it's going to follow, and your access point. You need to know those anatomical landmarks as to where they are and what it's called, and for each different type of movement that you do. One important thing to consider too is obviously the client's ability to move the joint. Most of the time, similar to manual muscle testing, I always try and have the resident or the client move their arms so I can kind of eyeball and see where they're probably going to be at. It also gives me an idea if there's things going on. If I'm trying to do shoulder flexion and the person's kind of hiking their shoulder up, or I can automatically see they're compensating. I'll try to maybe put them in a position where they're less able to try to cheat or compensate, or that's going to be more comfortable for them. So as I do the goniometry and I start stretching to see their maximum range, it'll be the most comfortable position for them, and also allow me the ability to manipulate or grab their body parts so that I can do that while maintaining the goniometer in the right place. Obviously, for goniometry, you want to make sure that you're looking out for any contraindications or precautions that you need to take. Things like sternal precautions, pacemakers, maybe rotator cuff injuries and pinched nerves, or maybe they have this osteoarthritis in the shoulder and they're very limited. So you would definitely want to be paying attention to the type of quality of that joint. If you have an arthritic or malformed joint, you're going to be very careful with that and pay attention to the end field as to what that looks like, and obviously using your client as for feedback and observing their facial expressions and their eyes or what they're saying to make sure that they're comfortable during the whole process and that we're not doing anything that's not comfortable for them. Sometimes clients will forget that they had an old injury, and that might have changed the integrity of their joint. And as you're doing those things, it'll remind them. And it's important to document it, as far as the end field, anything that the client might report at that time, as far as why there might be limitations, hypermobility, anything like that, you want to include in your documentation. For students, when I have students doing clinical rotations, some of the major challenges I find is sometimes just the placement of the goniometer is a challenge. And sometimes it's just the basics. Remember your anatomical locations and the movement that you're trying to do. I think even before you learn the degrees of movement that each joint has, it's going to help you a little bit more to get there if you really have a strong foundation as to the terminology for the joint movement and the plane that movement takes place. So if somebody says, okay, I want you to test shoulder flexion, as long as you know, well, shoulder flexion takes place on this sagittal plane, right? Then you know that the movement is going to be related to that, and it lets you know, well, I'm trying to measure that, I have to be on the side of the axis point, and that'll allow you to get there. Oftentimes with students, I think that they don't have that foundation, so as they're trying to problem solve, they're just putting the goniometer in awkward positions. Like, for example, if you put the goniometer up here, okay, that's clashing with the movement. Remember, the goniometer is going to follow the movement regardless of what plane you're going in. So understanding that basic concept will help you with that. The other thing I see students sometimes do is just the positioning of the client and of themselves. Remember, you want to be in a comfortable position. You want to be sitting down in a stool if it can be possible. If you have this client standing up, then that's fine too. But depending on the setting you're in, that may or may not be as easy to do with all your clients. But again, ultimately, you want to position them in a way that's comfortable for them, that prevents them from cheating, and that allows you to have your hands free to use a goniometer and position or stabilize them as needed. And sometimes I see students making that error, and even some licensed therapists as well. And the other thing is just your hand placement. Remembering the basic concept that if you're doing some sort of manual muscle testing or goniometry, you're usually keeping your hands one point away or one point towards that joint. You're usually not crossing multiple joints. And the last thing I'll share is that when students come into a clinic, one of the things that usually throws them for a loop is that when they're dealing with real patients, the patients aren't trying to help. The patients don't know what you're trying to do, which varies greatly from the lab. When students are practicing this in school, all the students are in the same class, they're practicing, they know what they're trying to do, and they usually have normal movement. So as they're doing these things, you have somebody who's kind of doing the movement for you. They're maybe guiding you as they, hinting you as you're going along, because they want you to be successful as well. And then what happens is you don't get the little variables that you would get with the client, in the sense that the client, they know you're testing them, but they don't know what you're testing exactly or how that's done. So they're not helping you, or sometimes their body, there's injuries, there's limitations, there's position issues, or even strength issues that people don't come into account. So keep in mind that when you're dealing with a real patient, positioning them, making sure that they're not going to lose their trunk control while you're doing it, or maybe laying them down on a mat so that you don't have to worry about that, or understanding that their strength might not be all there. I mean, I've had a student once going into shoulder flexion and then have the patient's hand just kind of plop them in their head. Obviously, the person didn't get hurt, but it's little things like that students don't usually anticipate, which you want to be careful with, and just for quality of service or potential injuries, and just general standard practice purposes. So those are the things that you want to try to be ready for as a new clinician or the student going into a level 2 rotation, is understand that the residents or the clients, depending on the setting that you're working in or you will be practicing in for your rotations, are going to have different limitations. It could be psychosocial, it could be physical, it could be endurance related, pain related, and you want to be able to anticipate that and work around that as best you can. All right, if you have any questions or any specific tips or any personal history examples of things that you've done well or things you would have done differently, go ahead and leave those in the comment box as well. And if you haven't done so already, please hit the like button, please share it, and please subscribe. Again, have a great day.